Hello, my name is Dr. Michael Mack. I'm one of the residents here at the University of Calgary, here to explain to you Cataract D anterior vitrectomy level 3. In this particular level, there is already vitreous from a posterior capsular rupture. What makes this level very challenging, and I had to take multiple takes, almost 30 attempts on this in order to get 100, is that the vitreous is actually adherent to the iris and other structures. So start off like you would with any of the other anterior vitrectomy levels, staying with the Triamcinolone, and then you want to start from back to front, making sure that you get most of the vitreous behind the posterior capsule so that you don't pull any of it forward, which would cause you to lose many points. Now here is the challenging part. The vitreous that's adherent to the iris needs to be removed. However, the simulator actually asks you to use the spatula, but I find the spatula just makes things a lot worse. So when I use the spatula, some of the vitreous starts to get entangled into the iris or goes to the cornea, and sometimes I accidentally touch the cornea with the spatula, and that causes a loss of points for your total score. So what I've been trying to do with this particular level is to actually use the vitrector to chase after the rest of the vitreous, trying to be as safe as possible, especially near structures like the anterior capsule and also the iris. So I turned the aspiration all the way up to 500, and then the vitrectomy cut rate almost to about 2000, so almost to the maximal settings. And I found some success that way. It's still very difficult, as you can tell. My hand is in very awkward positions when I'm chasing after the vitreous. But the simulator has an added problem where if you put the vitrector close to that of the irrigation handpiece, sometimes the machine just glitches out and then it says that you're touching the cornea. So I've had to deal with that as well, messing up my total score, which I wasn't very happy about. However, you do have to still persist, and we were able to capture this particular video where I did score 100, and you just have to be as careful as possible. So here I'm just using my technique, low flow rate, so about 5 to 10, lower bottle height at around 55, and then making sure that my irrigation is always on continuous. So I'm staining again. You notice that there's still a little bit of vitreous left there at the 3 o'clock sort of area. And I'm going to be getting after that in just a second. There's still a little bit of vitreous there, as you can tell in the directly below the posterior capsule. So I have to cut that away. And then the ones there near the side, I have to be very careful, and I almost have to angle it right above the iris, so my vitrector is pushing the iris down, and I'm turning my cutter opening or mouth towards that area. So that's how I got or completed that level there. Let's take a look at that one more time. So I stain it with Triamcinolone. I start at the bottom, right behind or below the posterior capsular rupture, and then I start cutting immediately. And again, my settings are relatively high aspiration settings, and also high cut rates as well. I'm staining a little bit more just to make sure that there's nothing below the posterior capsule that I've brought forward, and then I'm just chasing after the rest of that vitreous. Now I'm going to go after the pieces, and look how adherent it is to the iris. It's even bunching the iris up a little bit. So I'm just angling my cutter and turning the cutter almost a little bit facing towards the vitreous. This is pretty dangerous in real life. You could cut iris, you could cut capsule as well. So I don't think that this is realistic, to be honest. Using the spatula is also a little bit difficult as well, but I guess in real life, even if you touch the cornea a little bit, no one is going to yell at you and say that you've scratched the cornea, um, especially in a situation where you have a posterior capsular rupture. I think that's the least of your worries. So you just want to try to be as gentle and methodical as possible. Turn the cutter towards the remaining vitreous, and then you may be able to just use high aspiration rates to suck those pieces of vitreous towards your cutter and eventually get rid of it. So here again, I'm using my technique where I have a very low flow rate and low bottle height. I bring the pieces of the cortex to the center, and then I use the vitrector, not the aspirator, to get rid of the cortex piece. Then I'm just using my cutter here. It's pretty much done. So I'm going to stain one more time. I want to make sure that there's no more vitreous. And now I'm just cutting up the rest of the vitreous there. There's still a little bit left there, so I was able to successfully use high aspiration, just pull the vitreous towards the cutter, although in real life you may be worried about cutting the iris. So we scored 95 and 100 respectively on those attempts, and please like and subscribe for more videos. Thank you very much for watching.